Hello and welcome to this video walkthrough on how to compare Anthem Blue Cross plans side by side. My name is Dennis, and I'll walk you step by step through a process of comparing some of these plans and take a look at the benefits and finding out what all these different things mean, like deductible, co-insurance, copay, how the prescription drug coverage works, how deductible works. So we'll go into detail and find out. This is a second video to a first one, which I did on getting a quote. And in this video, since we already got a quote, I'll have it in front of me here. We just go into detail on how the different plans work and what you get for your money. So for this example, I used a single male living in San Francisco, California, who's age 35. And as you can see in front of me, I was able to get a quote. And right now I got a quote for what's called most popular plans here with Anthem, and as you can see up here, there's a little drop down here, and it's showing me most popular plans. So if when I was going through a quote process, it asked me what type of plans would I want based on my lifestyle. So I picked most popular, and it's giving me 4 different options. And as you can see here, it's giving me first row. I see my monthly premiums. And just right above that is plan names, and obviously, if I would like to submit application for one of these plans, then I just add to cart and keep going with the application process. So, as you can see here, we have 4 different plans. They're named Clear Protection Plus, Smart Sense Plus, Luminous HSA Plus, and Premier Plus. And let's jump into these plans and take a look at them and see what we get for our money here. So let's start with Clear Protection. That's our lowest price plan at $111, and now it's giving me here in this row plan type. PPO stands for Preferred Provider Organization. What that means to you is PPO plans lets you pick your doctors and hospitals. Insurance company does not get involved in where you can go or which doctor you can see. So you have flexibility of choosing doctors and hospitals. Next is your annual deductible. With all these plans here, except, well, I'll just start with this one. The way deductible works is, I get this asked a lot from folks, does that mean I have to meet a deductible before I get any benefits? Well, it depends on the plan. With this specific plan, no, you don't. So that means you have all the benefits before the deductible. So deductible is only, in this case, mainly where you're going to see it is your inpatient, outpatient procedures, surgeries. Okay, so that's where deductible is going to come in. Next number is annual maximum out of pocket. That's an important number because that's actually the reason you have health insurance in the first place, is to protect you against unforeseen large medical bills. And what the maximum out-of-pocket does, it's a built-in safety net to protect you that insurance companies have. And basically what it says, once this number is met in a year, and then you basically, the coverage becomes 100% coverage. There's nothing you have to pay out of your own pocket for any more medical expenses for the rest of the year. And let me explain you how it works. So every copay that you have, every time you go refill your prescription, every time you go get a lab work done for some kind of physical that you have to pay out of pocket, every dollar gets subtracted. Well, actually, first it goes into a deductible. So first the deductible obviously decreases. So every dollar, even if you spend it on your pocket, is decreasing this deductible. Once deductible is met, then you have another $3,500 to meet, and then the coverage becomes 100%. Okay, so you have deductible. So basically, your total maximum out of pocket that you can be in any given year, like she says, in addition to a deductible, as you can see right here, where it says, some plans will not say that, but this says right there. You can see in addition to deductible. So $3,500 plus $3,300. That's your worst case scenario in any given year. Next number is co-insurance. Co-insurance is a percentage of the bill that you'll be responsible after your deductible is met. So, and that's how the maximum out of pocket comes in. So let's say you have a inpatient surgery, you're checked into the hospital for some kind of, God forbid, you've been in a car accident, So you met your deductible, and with the hospital you're gonna meet that in the first day. Then you'll be paying 40% of negotiated fees. That means you'll be still responsible for 40% up to $3,500. So no matter what, you reach that $3,500 after deductible, and that's it. You have 100% coverage. You don't pay anymore. And outpatient surgery, it says here 100% of negotiated fee. Basically, what it means is you actually have to meet 3,300 plus that's 6,800 before the outpatient surgeries are covered. Okay, so that's why we're looking at this. We're looking at this low monthly premium, and that's why it's going to have some of these higher percentages here. As we go higher in monthly premiums, some of these things, as you will see, would get the percentages that you're responsible for would get lower and lower and lower. The office visit. This is your regular doctor office visit that you would go to see your doctor, and you can see it's a $40 copay for first 2 visits per member. Per year, deductible is waived, so there's no deductible. You just pay $40, and it covers 2 visits per year. Now, one thing to keep in mind with all the Anthem Blue Cross plans, no exception, your yearly physicals, mammograms, checkups, anything that has to do with preventative care, anything that has to do with lab work for preventative care is covered 100% with no copay, no deductible. It's 100% coverage. Okay, so keep that in mind. So the office visits are not that's not your yearly physicals. This is separate. This is your sick visits, basically. You go and you think there's something wrong with you. You want to go see your doctor. That's what the office visit for. And on top of that, you have physical exams, preventative care, it's called. That's all covered before the deductible, and there's no copay. Okay. And drug coverage with this plan covers brand name and generic drugs. Okay, so let's take a look at SmartSense Plus plan. It's at $139 per month. It is a PPO. Again, that means it lets you pick your doctors and hospitals. Our deductible here was set on $6,000, and you can see the first number, $6,000, and there's a second number. Well, that means actually underneath here it says single and family. Well, that's for a single person. That's for a family. So if I was getting this quote for a family, the total family deductible would have been $12,000. So if I drop it to, it's going to give me 2 options here. If I choose my $3,500 deductible, you can see my looks like my monthly went up by $8. So 147 instead of 139 if I choose a $3,500 deductible. Again, the annual maximum out of pocket is $3,500. So to have total maximum out of pocket is $3,500 plus $3,500, which is $7,000. And in this plan, you can see it's only 30% of negotiated fee after deductible, and there's no such thing as inpatient, outpatient. Everything is the same. Inpatient and outpatient is covered at 70%. So insurance company after deductible will pay 70% of all my bills up to $3,500. After that, it's 100% coverage. Okay. Office visits. With this plan, office visits are $10 cheaper than the one we looked at earlier. It's $30 copay, and it's 3 visits per year. That's covered. And again, this plan still has preventative care that's covered 100%. So physical exams, mammograms, any kind of checkups like that, any preventative care, it's covered 100%. And that's built into every plan. And the reason for that is that's part of the health reform law that was signed last year, and it's one of the provisions that insurance companies have to comply for is to offer preventative care that's covered 100%, and that's already automatically built in with every plan across the board. So just to keep that in mind. And prescription drug coverage, it's a standard with the SmartSense standard. It stands for actually does cover brand names and generics. So you still have brand name and generic drug coverage with SmartSense. Let's take a look at Luminos here. Luminos HSA Plus. HSA stands for Health Savings Account. If you're not familiar with how HSA plans work, there's plenty of resources online that you can look into and find out how HSAs work. The simple way to explain it is basically HSA is actually stands for Health Savings Account. It works exact same way as your 401k at work, if you're familiar with that. Just it's designed for medical bills. The money that goes in there is designed to pay for your medical expenses or medical bills. And the way it works is you have your health insurance side by side with health savings account. Okay, so they work together. And what it allows you to do is basically what insurance companies say is that if you insure yourself up to deductible, self-insure yourself, will give you a lower monthly premium. And that's what this, if you look at this plan here, it's actually really easy to understand, really easy to follow. Let's take a look at this. So this is an HSA plan. It works in the same way as PPO. So again, you have choice of doctors and hospitals. Deductible is $4,500. Okay. And then annual out-of-pocket maximum is 0, so there's no such thing. It's $4,500, and that's it. Co-insurance is 0. That means you pay nothing after deductible, and it's 100% coverage after deductible, so it's 0% after deductible. So all your visits, everything is covered. Basically, it's a $4,500 deductible. Once deductible is met, it's 100% coverage. And again, as a reminder, this plan does cover preventative care at 100% also. There's no copays or deductibles with Lumino's HSA. Okay, so if you go get your yearly physical or checkup, you pay nothing. So it's a really easy to understand plan. The absolute worst case scenario you can be out of your pocket is $4,500 in a year, which is not bad for medical expenses, considering that average hospital stay is $7,500 a day. $4,500. It's not that it's nothing compared to how big medical bills can get. So it's really easy to understand. And with this plan, you can set up an HSA account side by side, where you have an option, to put away $4,500 into this HSA account and keep it there if you choose. And you don't have to put in all $4,500. You can set up, you can put $100 a month or anything you want. And it's as flexible as the savings account you have at your bank. Just it tends to pay more interest. And the money is designed, you put that money in the savings account, health savings account, and it's tax-free. You never pay taxes on it. And when you pay for medical bills or expenses, you never pay taxes on it. So it's a great way to save some money and not pay taxes on it. And you can use that money obviously to offset the deductible. And then this way you get a lower monthly premium. Low monthly premium. That's the benefit of HSAs. Let's take a look at Premier Plus, our last plan here. With this plan is $172 a month. It's a PPO, so you have a choice of doctors and hospitals. Deductible for a single person is $5,000, so that's be my deductible. Maximum out of pocket is $4,500, and the co-insurance you can see is 25%. So it's only I'd be responsible for 25% after $5,000 up to $4,500. So my worst case scenario with this plan is $9,500. Okay, and then a doctor office visits is $30 for non-specialist and it's $50 for specialist. And this is unlimited doctor office visits. So if you have a family with young kids, or you think you might need to go to a doctor more often than some of these plans here, up to 3 visits per year, then this might be your option for you. Okay, so it's unlimited doctor office visits. You can go as often as you want, and all you pay is $30 or $50 for a specialist. And the brand name drug it covers brand names and generic drugs, and also you have a built-in vision coverage built into the plan. So if you it lets you save some money on your contacts, prescriptions, checkups for your eye exams and things like that. That's all covered. So these are your plans. These are most popular plans. You can also, if you were looking at the family plans, then obviously it's going to give me an option for family plans, and it's going to make some recommendations, which might be better choices for family plans. And you can see it's going to give me 3 different options: Clear Protection, Smart Sense, and Premier Plus plans. If I'm looking at the maternity plan that covers maternity, the only 2 plans, if I click on View All Plans, is the PPO Share and HMO plans, and you can see it covers maternity. So that's that. I hope this was helpful to you. I'm gonna see if I can do some different. If you have any questions, by the way, you can welcome to email me at my site at getmymedical.com. I hope this video was answered some questions for you. If you like to apply for Anthem Blue Cross, again, you just click on Add to Cart and continue with the application process, and it'll walk you step by step through application. Thanks. Thanks a lot, and I hope you have a great day. Take care.